When I was asked to join this ECHO, I knew I couldn't turn down the opportunity. It consists of so many multidisciplinary team members, people that are involved in the community, doing important advocacy work, doing peer support work. It is a community of like-minded people, but also people that want to learn more and enhance and enrich their practices.
I think lots of times in clinical practice, we really work in silos. So even though you might be present at work with different people from different professions, a nursing or social work or someone from pastoral services or a general obstetrician gynecologist, there isn't necessarily a lot of time to really delve into a single issue or a clinical case with people and get multidisciplinary feedback.
How ECHO breaks down those barriers, and I think we do it in a number of ways. Number one, I think having the hub team be diversified is really important. And also having the hub team take on all of the roles. So we all rotate, being the facilitator, being the presenter.
ECHO is that match, that it's New Jersey specific resources and people, and it's designed that everybody can show up. Clinicians, community programs.
The doula sisterhood, as I like to call us, is on ECHO often. Community health workers are on ECHO often. So, and then we also sometimes add our clients, like some of my clients, certain echoes that are things that they kind of should know about, I invite them to jump on.
We have community chats with folks from the community coming in and hearing things for the first time. And they're like, gee, I never thought about that. I never thought that as a dad, that I should be part of this birthing process, that I have rights.
The idea behind the community chats was to make it a little less formal, even as we kind of think that it's not really that formal, but a little less formal in terms of the didactic, and really just throw out some questions and really hear from people in the community. And that could be people working, out in the community, out in the field. It could also be actually community members.
We've definitely seen a network created throughout the ECHO series. We've seen some of our regular participants that we expect to be joining in every session. And we also see that they're inviting their colleagues and coworkers and friends and saying, you have to check this out. I've had other folks reach out to me via email after a session and follow up and say, hey, you did a great job. I want to learn more about that, or I have questions, or here's another resource that you didn't include that we think is important for you to have.
I felt were really valuable in bringing people together and have that multidisciplinary approach, letting people have the opportunity to both listen and participate. It was not only the subject matter, but the way the subject matter was presented was really appealing.
Whether you showed up for one or you showed up for 10, all of the leadership team seemed to really welcome everyone.
I love the community element of the ECHO. There are so many people from across so many diverse organizations and employments and practices that are represented. And what's amazing is you can have pushing 200 people on a call, and yet it still feels like a really intimate community.
To have something that is really interdisciplinary with a variety of people and open, really truly open and accessible to the broader community of caring providers is really valuable.
And when there was an identified lack of participation in certain counties, the Rutgers ECHO team strategically brought in other participants so that we could engage with people throughout the state. And there are not any other programs that are doing that successfully, and they're not doing it as well as Rutgers ECHO.